Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Welcome to this episode of the Healthcare Connections podcast. I'm your host, Jeremy Winn, with Healthcare Compliance Pros, the Director of Sales. And today's going to be a fun one. I really, really love this guest, and you're going to learn to love her too. We've got Jackie Coult on. She is the founder and CEO of Complete Healthcare Business Consulting. She is a certified healthcare business consultant and been doing this for a lot of years. So welcome, Jackie.
Thank you. Glad to be here.
Yeah, we're so excited to have you. This has been a couple weeks in the making, almost a month and a half in the making, and so this has been good. I'd love, Jackie, you certainly deserve a very good, thorough intro. So I want to give you that opportunity to share with our listeners more about you.
Perfect. Well, thank you. Thank you. I've been a fan of HC Pro from its inception, so glad to be here. I've been consulting in the business for about 30 years. I've been administrator of facilities and done mergers, acquisitions, etc. Mostly focusing on physician, improved profitability, efficiencies, and quality. And that's what our firm's about, and trying to help, navigate this ever-changing healthcare. So we do, well, for full service, so we do almost everything. We've touched almost everything a physician would need, in their practice or growth or expansion, startups, whatever. So really, I'm passionate about it, and just so glad to help any way we can.
That's awesome. Thank you. And yes, Jackie's been a longtime friend and partner of HCP. So it's been really good to have her expertise and really to have that relationship for us as well. So I asked Jackie, what are you passionate about? What are some things that really get you fired up that we could talk about on this episode? And I love what she went to. The first thing she said was, let's talk a little bit about revenue. Physicians are finding it more and more difficult to run a profitable business. I think we're seeing that. Reimbursements are, always seem to be going down, and yet expenses are going the opposite direction. They're rising, and for any business, that can be a really difficult scenario. So, Jackie, what are some ways for physicians and practices to increase revenue quickly?
Well, what we've seen in many years is it takes about 30 to 60 days, but it's very effective. What we found is 100% of the practices have earned the money but not captured it. And what does that mean? In the fact that they're not watching, what their contracted reimbursement is. And so when they bill out a service, it's below the max payer, or the payer is paying a default. So their charges are not being watched. And if you have $100 for this service or supply and it's on a default, then Blue Cross could be paying you $80 and United Healthcare paying you 10.
Wow.
So you really need to watch it. So if you're looking for something to really rev up the revenue quickly, that's the ticket. It does require that you know all your contracts, all your fee schedules, and adjust your gross charges, based on a maximization approach. No longer can we use a percentage of gross charge or the Ingenix book at 90%, a percent of RVUs. None of those methods work because every payer's reimbursements are so different and dynamic that it's really on a CPT code level. But if you want to get revenue quick, That's the way.
Yeah.
The other thing is, if we could increase that revenue, can, make sure that your revenue cycle is efficient
Yeah.
because, you know, if it's not efficient, you don't capture it. So, you want to be able to capture it fast, but make sure, if you know what the payers are paying, then you can collect at the time of service and, make sure all eligibility. I mean, we're finding that the revenue cycle has not really, it's a team thing throughout the
Yeah.
entire practice, and they're not really focusing on that.
Okay. Have you seen, like a typical percentage of increase just by zeroing in on, like you said, your contracts and just being really aware of what you should be getting paid? Is there a typical range of percentage where revenue can increase after that? Would you say 30 to 60 days? I mean, it takes a little bit of time, but just curious if you've seen a typical increase.
I guess it depends, how long has it been since you've negotiated? How long has it been since you looked at your fee schedules, right?
Yeah.
And, if it's been, 12, 10, 12 years, then you probably have at least 10 to 15% revenue on the table that you've earned, but you haven't captured.
Wow.
If it hasn't been too long since you've been looking at that, we're seeing the minimum about 3%. But there has been some that have been pretty significant, especially if it's a orthopedic or derm
Yeah.
or somewhere where we have some pretty high revenue. We can see some pretty instant increases, just by changing the gross charge. Super easy.
Okay. That's awesome. Thank you. And again, like you said, 3% on a high volume, high revenue, practice is significant. So that's
Well, it'll
fantastic.
at least mitigate Medicare's decrease, right?
Well, yeah, exactly right. It'll help. So let's dive into payer contracting. I know this is an area that you spend a lot of time on, and you work with a lot of clients on this. Give us some of your best strategies and tips, for practices to be more effective in their contracting.
Yeah, we have a pretty big prong approach, and that is again going back and inventorying all the contracts, amendments, and fee schedules, and what services you're providing, utilization essentially
Yeah.
of that, and then we make sure that we look at all the terms. So, I don't want to go after a payer when you've signed a contract and you still have 2 more years, right? So
Right.
we kind of do a payer matrix and make sure that we have everything. We've inventoried all of those things and understand what everybody's paying, because one of the strategies that we have is looking at what is your market reimbursements? What is your market reimbursement?
Yeah.
So if you have a payer that's paying, a $300 and everybody else is paying 150, why? So, kind of doing an analysis of your fee schedule based on your utilization is required, because you can't negotiate with a payer without it. Uh, the next thing is, comparing when they come back with an offer. What we're finding, you can go to United Healthcare and say, hey, I need, or Cigna, whoever, I need an increase, and they send back a certain percentage. Get the
Mhm.
fee schedule, compare it to what your utilization, because we're finding that based on your utilization and your CPT codes, that it is not an increase. It
Interesting.
is not. So
Interesting.
um, we validate what they're, stating. We also have, been on a bandwagon because of the viability issues we're seeing in practices. And I'm talking primary care, pediatrics, all the way across the board.
Yeah.
I mean, they're hurting out here and it is tough. Um, is making sure they know what the cost is. No more can we accept $100 when it costs us 125 to provide it,
Yep.
and actually giving those costs. We can do a break even by CPT code within any practice. But then also, like mental health and PT and OT, what's your operating cost? What does it cost for a therapist? I mean, half of the time we look and they're not even covering the therapist cost for an hour, let
Right.
alone, overhead. So getting those costs is important and putting it out there, and then, we also use how long has it been? How much have they increased their premiums lately? What's their net profit,
Yeah.
right?
Right.
Because if you haven't had an increase for 12 years and they're boasting a $1.7 billion profit, net profit every year, something's wrong here. I
Yeah.
mean, it's profit over patience by far.
Yeah.
So there's, several strategies we use. There's also the last one that has been really key lately, is the transparency in coverage rule of 2020. Payers are supposed to publish their contracted rates for all physicians across the country.
Hmm.
Well, it's a conundrum, it's getting better, but the data is vital because we can actually see by specialists, by taxonomy code, by MPI, what they're paying others. And that is a game changer.
Absolutely. A little transparency is good for all of us in this industry.
Right.
Wow.
Transparency has been a real game changer, actually.
Okay. Thank you for that. I appreciate that. That's really helpful. I want to talk a little bit about there's a great organization out there that you're a member of, that we've partnered with for a lot of years. It's NSCHBC, which stands for the National Society of Certified Healthcare Business Consultants. And the reason I want to touch on it is, this is such a vital organization in the industry that is doing so much to help physicians, and practice owners all throughout the country. Maybe touch on a little bit, Jackie, if you don't mind, because I know you're a vital part of this group. You're kind of the life of the party, when it, at the conference. And so, tell us a little bit about the organization, how that's helped you personally, but also what that does for your clients. With you being part of that, and healthcare in general.
Yeah, I was with a big firm, great guys out of Arizona, and I went solo. They were getting ready to retire. I went solo, and you have a question, or you want to validate something, and with your peers, and who is that now? So as a solo practitioner, I also wanted to sharpen my pencil. So I seeked out certification in healthcare consulting and found the NSCHBC. I became a member in 2008. I certified that year, and have served on the board for many many years. And the education that all of us bring together, I don't know much about, I'm not a CPA, I don't do taxes, but it's
Yeah.
nice to know certain things, within the industry about taxes, or, CPA might not know anything about practice management. And, we educate each other. We keep up on the latest, industry trends, what's working, what's not, solutions, compliance
Hmm.
and whatnot, and really educate. But then if we have a tough question, or we haven't seen this before, we can run it across our peers. It's really invaluable for our firm. you know um, it's great to have that backing of your peers, and the knowledge that you need to get it right, and help any way you can out there. It's ever changing healthcare industry, that's for
Yep.
sure.
Absolutely. Yeah. It's what I as we were at the conference in January. To me, it was really impressive just to see the range of topics that was discussed when it came to healthcare, and how there was several members that are experts in this area, other members that are experts in this area of healthcare, and to collaborate together so you can gain knowledge, right? Like, okay, I'm not maybe not as strong in this area, but guess what? I've got 4 or 5 colleagues in this organization that are experts, and I can lean on them. Like, I thought that was really impressive, and so I think it's an important organization, which is why I wanted to touch on it. One that I think is really helping, again, physicians, in a time in healthcare that is for them is frustrating, I think, and really really difficult to try and stay afloat and really focus on what they want to do, which is take care of patients. Everything else is overwhelming them. So it's great having people like you that can support them.
Well, it's interesting because mergers and acquisitions. So I don't do valuations, but hey, there's a couple of experts out here that do an amazing job. Or I have OIG coming in and auditing,
Yeah.
or a PIC or a MIC from Medicare auditing a provider on their claims. We have specialists, that we can tap into, or coding audits,
Yep.
tap into you guys. And all those things really actually help the entire system for the providers and healthcare entities as a whole, because we do know the specialists that do a great job, and know what they're doing, and so that they can get great service.
Wonderful. Well, Jackie, thank you so much for being on today. For those that are listening, if they do want to get a hold of you, Jackie, what is the best way to get in contact with you?
You bet. We have our website is C as in Charlie, H as in Henry, C as in Charlie, B as in boy, consulting.com, or Jackie at chcbconsulting.com. Or feel free to call 801-274-2677.
Awesome. And we'll make sure and put that information up at the end of the episode so people can see that. But Jackie, again, so much fun having you on. I look forward to continuing to partner with you and have a lot of great chances to connect and support clients together over the years.
Well, thank you, because you've supported me. I have loved Healthcare Compliance Pro. You've supported our compliance within our firm. But when I have a provider going up against the OIG for a cyber attack, I am so glad to have you as the partner, because it saved the day. So thank you.
Thank you. Well, you're too kind. You're too kind. Thanks, Jackie.
All right. Take care.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.